To begin, we're going to hear from two employers, Genentech and the Ohio State University, and they're going to share some of their best-in-class strategies that they've developed around evidence-based cancer care and high-quality cancer care within their benefits. So I'm going to welcome Cody and Jason up to join me here in a moment. I'm going to introduce them for you, give you some background on them. So Cody Adams is currently the benefits manager at Genentech. He's been with the organization for over 9 years and joined the US Total Rewards team in March of 2020. He leads health improvement benefit programs and initiatives offered nationally to their 22,000 US Roche and Genentech employees and their eligible dependents. So he brings employee engagement and corporate well-being experience to advocate for progressive employee-first benefits. Our second speaker and joining Cody is Jason Walsh from the Ohio State University. Jason has more than 20 years of healthcare experience. He's worked in progressively responsible roles at Ohio State University Wexner Medical Center, and today serves as the Senior Director, Business Operations and Business Development. And he currently serves as the Ohio State Cancer Bridge Liaison. So welcome, Cody and Jason. Thank you for being with us today.
Good morning, Cody. Good to see you again.
Good to see you.
Well, it's nice to be here. Employers Health. I actually am from Stark County, so I'm glad to be here and see all of you and meet those who I've just met. And for those who are coming out of town, welcome to Columbus, Ohio. I've been here for 22 years. 22 years at Ohio State. So I'm really happy to be here and talk to you guys about Cancer Bridge today. So,
awesome. Yeah. Hi, everyone. I'm Cody Adams. Came here this morning from Indianapolis, so just your neighbors. Yeah, it's a pleasure to be here. It's a beautiful area. This is actually my first time, I think, in Columbus. So it's nice to be here. I'm a fan of Pat McAfee, the Pat McAfee show, and he was just on campus a couple weeks ago for the college game day. So I watched that. It seemed like Ohio State fans. It's a thing, right? I mean, yeah. So awesome. Well, it's great to be here. I think both of us have some slides we're walking through.
Please
I get to go first.
Yeah.
So yeah, we'll jump right in. So health equity. When we think about oncology, we do think as an organization about health equity and just our cancer care benefits in general. So what I'm going to do is just give you an overview of who we are as an organization, how we think about our oncology benefits, and how we're thinking of it from a health equity lens. And I will say, this has been something that's evolved over the last few years. We've been really diving into the health equity side of things. We put in a data warehouse. And one of the pieces that we did as we built our data warehouse was actually to funnel in the demographic data. So that way, when we start seeing claims and member experience, we're actually tracking it based on race, ethnicity. We're basing off of tenure. We're able to do different cuts, exempt, non-exempt status, location. So that's one of the things that we're doing. So that's one of the ways we're addressing it. But a little bit about who we are. So Roche Genentech is all across the U.S. We've got about 23,000 employees across the U.S. Our main headquarters are based in South San Francisco, which is the Genentech headquarters. The reason why I work for Genentech, but I'm based out of Indianapolis and I'm not in a sales role, is because I actually came from our diagnostic affiliate where I worked for about 8 years before transitioning over to Genentech in 2020. And so you can see we're kind of spaced throughout the U.S. And we do have both diagnostic and pharmaceutical products. So we have companion diagnostics. This is really who we are. We are a company that is looking at personalized medicine and how do we do that both from a pharmaceutical perspective and a diagnostic side. So as we think about our oncology benefits, we really think about it from three pieces of the journey: the prevention and screening side, diagnostics and diagnosis, and then the treatment side. And so we'll jump in with the prevention. Why is it important? This probably isn't a huge shock to anybody, but this is looking at our own data and looking at the difference in cost based on when we are diagnosing breast cancer and the severity level and the costs associated. So as you can see, if we're able to diagnose at a severity level 1 or 2, even 3, the costs on this side are pretty good. But as you get into severity level 4, and if you delay getting care, we see those costs spike up. And so it's really important that we're encouraging our people to go out and get screened and for that early detection, because really the data is showing it, right? Like these are real dollars that are associated with these claims and experience, in addition to that patient experience. in what they go through as a patient. And something else that we've learned in our data is we are really trying to be a best-in-class organization. We are a healthcare company, and we are really in oncology. And so we think we should be best in class when it comes to screenings, cervical screenings, colorectal screenings, breast cancer screenings, and we're not there yet. Our goal is to be at the 2030 line for healthy people. We are not there yet, but we are tracking and trending that way. And one thing that we found in our data is actually, if you have an annual wellness visit, your compliance rate towards getting those screenings goes up by significantly. And you can see the numbers at the bottom of the screen here. 19.9% for mammogram screenings, your compliance rates go up. So we're really encouraging people to go get annual physicals, which then we're seeing trend into getting those preventive screenings that they're due for. And how are we doing that? Well, yes, we do the education, we do the communication, but we are actually putting some dollars behind it as well. So not only are these things covered at 100%, but we're also incentivizing people through an additional reward program, an incentive program, where people get incentivized to go and get annual physicals done. Go and get that preventive screening that you've been putting off. Go and get your biometrics. We have over 20 activities in total that people can go get incentivized for. They can earn up to $500 as an employee. If their spouse, domestic partner is covered on our plan, they can earn $300. But really, we put the most money behind these preventive screenings. They can go do, financial one-on-one consults. They can do a mental health checkup. We do like the full spectrum of health from an incentive program perspective. But when it comes to putting the most dollars somewhere, they go towards the preventive care side. So that's something that we've done in our program to really encourage people to get back to care. Everybody saw the dip when COVID happened, right? I mean, it was just like a roller coaster, just straight down. As soon as COVID hit, we saw our screening rates and we were just like everybody else. But through our incentive program, which ironically launched in 2020, so it was good timing for us, we were able to bounce back and actually get our screening rates back up to pre-pandemic numbers at the end of 2020. So we were able to bounce back at a quicker rate than what some others were able to experience. And some of the other things are just good old communication. I don't know how many people struggle with communications or feel like as benefits managers, I think one of the most common things I hear from employees is, I had no idea we even offered this. And it may have been, we just sent an email last week about it, or we sent a postcard home. We've communicated until we're blue in the face, but we still hear it all the time of like, gosh, we had no idea. It'd be great to know this. And I say that, I know I have colleagues in the room and it's okay. You're not alone in telling us that. But really what we've been trying to do is make sure that we're putting screening education as part of our communications campaign. We're not just promoting our benefits, but we're promoting reasons why you should go get screened. We're promoting the importance behind it. Something that we're thinking about doing for 2024 is the education around time off. Like, how do you even code the time off to go and get screened? Like, we pay people to go get screened. Like, take the time off of work. We support that as an organization. Go have your doctor's appointment. But a lot of people don't know how to code that. And so that could be a barrier for them. So how do we build out a communication campaign around, here's how you code time off, managers, here's how you support your people, here's how they're able to code it. So really just educating people around that. But, you see these other initiatives, right? Like as an organization, we have Cancer Screen Week. It's coming up. It's a great opportunity to use some of the materials available online. It's the first week of December, but we actually send that out internally to our own employees so they're aware. We do a postcard home. We work with our carrier to do targeted campaigns to members that have gaps in care. And it's really amazing. Like, we think snail mail postcards are like, well, we have email. Like, it's cheaper to do email. Why would we do snail mail? Why would we still send something? But it's funny, you can reach the spouses, domestic partners that way. You can reach the family members. And sometimes, like, I'm kind of old school. Like, I like getting pieces of mail that aren't bills. Like, I'm like, okay, this is junk. Oh, what is this? And one of my colleagues on the benefits team actually said it was a piece of mail that got her husband to go get screened. And he lives in the house with the benefits manager who also manages the health plan with me, talks about this all the time, talks about the importance. But it was the piece of mail that really motivated him to go do it. And it did mention the rewards. We do make sure people are aware that they earn rewards. But those are some of the pieces that we do. And it's really just educating people around, when might you be due? What are you due for at your age? Talk about family history as well. So it's just educating and reminding people that these screenings exist, that they're important, and to make sure you go out and do it. And like I mentioned earlier, as we think about health equity, if you don't measure it, you can't really see what's going on. And so when we put in the data warehouse, we did make it a point to get sign off from our privacy and legal teams to feed in demographic data. And so now we're able to get cuts like this out of our own data, where it shows, disparities in care, where we're seeing gaps in utilization based on race, ethnicity, where we're seeing gaps based on exempt, non-exempt status, male, female demographics. And so it's going to help us actually have an approach going forward, working with business resource groups or what we call DNA groups, having conversations with employees, doing more targeted communications and outreach. Again, as we think about exempt, non-exempt, it may be a time coding question and barrier. So how do we address that as well? So that's where including this type of data into a data warehouse where you're able to pull these types of results and just see what the data shows is really helpful. One of the learnings for us was, typically in the space, you're hearing a lot of disparities when it comes to the African-American community, gaps in care there. For us, we're not necessarily seeing that same gap as the broader market. For us, we're seeing it in our Asian population and our Latinx population. So that was kind of an aha moment for us that, we're hearing all of these things out in the community and like other employers being impacted, or like here's what they're seeing in their data. But now we can actually look at our own and create a plan to move those needles forward. So that was a lot around screening and testing, or screening and prevention. Now going into diagnosis, we really are trying to remove barriers. That's our kind of ultimate goal. We've removed age requirements. We cover testing, we cover genetic testing, we cover biomarker testing. So we really do a lot to try to support people through that journey to make sure that they're getting the right diagnosis at the right time. You can see all the stuff that we put up here, but really our ultimate goal is to remove barriers. One of the things that we also learned just in the last couple of years was for colonoscopies, there is a branded prep kit that a member can get. They go to the pharmacy, their provider wrote a brand prep kit. Typically, insurance denies that because you can get over-the-counter, medications or prep items. You kind of piece it all together and you can create the kit yourself through OTCs. But, it's an $80 kit, $90 kit. So in the grand scheme of it, we would rather remove that $80, $90 like bad experience for a member. They go pick up the kit, get it covered at 100%, have their colonoscopy, and hey, this was seamless. Versus like we're fighting over $80 or $90 and this could lead to a bad experience and then them question it down the road. Like, do I really want to do a colonoscopy? Like, I don't think a lot of people are super excited in the first place. So if we can remove at least one of those barriers along the way, that's what we did. But, it took a member reaching out to us. We didn't know this. And so it was a member reaching out saying like, hey, I got charged for this. You always talk about it being covered at 100%. Yeah, let's take a look at this. Let's see if we can waive this. And so that's something that we've done as well. And then as we get into treatment, these are kind of our four main pillars of looking at personalized healthcare, really encouraging people to go get those biomarker testing, genetic testing, making sure that it's the right treatment for them. We also partner with Access Hope for our second opinion services, and they help provide that second opinion expert level oncology support for members. A reason why we went that route was because it allowed the member to stay at home and work with their treating oncologists and local treating oncologists versus traveling somewhere else to like a COE. So that's why we went down that path. We've also been really supportive of clinical trials. Access Hope helps members identify those as well, but we support travel and lodging for clinical trials. We support anything that isn't covered by the clinical trial itself. We'll cover on the medical plan side and support members through that journey as well. We provide compassionate support. And what that means is we have a dedicated team of oncology nurses that when a member is diagnosed, it triggers an outreach from an oncology nurse to basically say, hey, we're here to catch you. We're here to help support you through this journey. We also have 25 free mental health sessions through our EAP provider. And that's for every single family member in the house. So just helping them from a mental health support, helping support caregivers along the way, helping support the patient along the way. And then finally, this has been a learning. And again, as we think about health equity, we as an organization have the X Project that we're supporting. It's really focused around women's health. And disparities that we see in women's health across the world. And a key area of focus for us is actually oncofertility. And so this was a term I had never heard until about a year ago, and through the X Project. And it's an area now that we as a benefits team are really working with our family building solution to help educate members that, hey, if you're in childbearing years and you're facing a cancer treatment path that may jeopardize your ability to form a family down the road, have this conversation up front around egg preservation, sperm preservation, so that way you can do this prior to getting into treatment and then potentially jeopardizing that in the future. And so this has been a real aha for us. We've worked with them to get information to those oncology nurses, let them know that they can help fast track them into treatment and to getting those things done before they start treatment. Because again, we know that it's like a really quick turnaround a lot of times to get people started on treatment. And so they can help fast track people in and get those things done. And I have not read it, but I know the Today Show had a recent story about oncofertility, about a college age student who was diagnosed with cancer, and they were actually talking about oncofertility. So I think it's something that we're going to hear more and more about, which is great. I mean, honestly, people should know before they jump into something what the long-term impact is. And this is definitely an area that has an impact. We have 3 kids at home. And so I can just imagine, like, for those that are already going through such a challenging time, traumatic time, hearing you have a cancer diagnosis, to then think about the long-term impacts, and just making sure we're really supporting people holistically. So this is kind of just the overview, right? Like, what's the key takeaways? What would be our kind of like blueprint or recommendations as an employer, as some of the best practices we've had? And it's really just listed out here. We're sharing the slides. And so feel free to go through these. If you have questions, reach out. Happy to help answer. But with that, I think I'll kick it back over.
Come on in, please. I'm accruing a little group out here in the hall. Well, thank you, Cody. And thanks again for hosting us. So Jason Walsh, I'm Senior Director. I do work at the Ohio State University Wexner Medical Center, the James, and the Comprehensive Cancer Center, and the Solov Research Institute. A lot of awards. Ohio State's known for that. We have an agnostic business called Cancer Bridge, which is one of our arms for extension to our public health efforts to improve cancer care. The advantage for us, though, is that we are sitting in a comprehensive cancer center, NCI designated. We are one of the world's best cancer centers, center of excellence. And so we leverage all the resources in the James. So while I talk, and I'm going to stay focused on Cancer Bridge today, I have many, many hats. I do digital pathology, AI development, commercialization. So I'm working on those efforts at the university. I work with cell therapy manufacturing and production, so those advancements in immunotherapy are coming. I work with the genetic team, and so you'll see Cancer Bridge. But what we're doing is we're referring a lot to what we have at the Ohio State University and the James. So I appreciate you guys having us again, and we'll chat about Cancer Bridge. I have 2 of my teammates here, one from Ohio State for our Employer Health group, Ryan, and then my colleague Doug, a teammate for Cancer Bridge. So we're here to answer any questions. Cancer is different for everyone. I think you guys heard from Cody today about all the opportunities. And really, I think at the end of the day, cancer is such an emotional and traumatic experience for people. The word alone, oftentimes when people hear the word Cancer Bridge, they think, gosh, that branding's so bad. Can you remove cancer from it? Because it's such a traumatic, emotional experience that I think we just want to really show our employees how important it is to be proactive and not be afraid and let fear drive your decision-making. So we really work on empowerment. This thing is very small, and I forgot my reading glasses, so I'm going to be looking back at this. I apologize. The impact of cancer, I think the greatest thing is cancer is the second most common cause of death in the United States. Obviously, that's why we're all here and we're having these conversations. I think we're going to have even more in the next 10 to 15 years. Mental health, the aspects of the emotionality of it is really around making sure we mitigate the absenteeism and presenteeism of our workforces. So after a cancer diagnosis, people experience a lot of sadness, anxiety, and anger, which we talked about, and hopelessness. Really, Cancer Bridge is a vehicle to help empower them. And it's an agnostic vehicle. So it's not your payer, it's not your employer, and it's not anyone except for your healthcare experts that are the cutting edge experts of cancer. That are there to advocate for you. And then the financial components, obviously cancer costs are very expensive. As a comprehensive cancer center, my old role was business ops, so I'm behind the scenes. I know how expensive it is. But I also think it's really important for the consumer to understand what you get what you pay for many times. And these centers of excellence that are driving differentiation and immunotherapy and cell therapy are expensive because those things fund the advancements for cure, right? And by the way, we're at 75% curing rate of cancer right now in our current economy, our current workforce components. So again, you guys feel it from employers and payers. The cost of cancer-related healthcare is expected to increase by 35% by 2035. And in our workforce, again, 1 in 3 adults are in America are diagnosed with cancer, and a third of those employees could find themselves on receiving that diagnosis. So our mission and vision really for Cancer Bridge is really around providing our partners and employees with that immediate access to cancer experts, and I'll talk about what all that entails, and support services and education focused on cancer prevention and early detection. Our vision is really to be a national center of excellence of cancer navigation support services, and while Cancer Bridge is the front of that, and I'll talk about why that exists and why we're agnostic, because we refer to all NCI locations. We are not about making people come to Ohio State, and it's not about a conversion. Framework for supportive care. Navigation is a key. So we actually have a certified oncology nurse call line. It actually is called the James line for people who are within the James system. But when they call in through Cancer Bridge, it's Cancer Bridge, but it's the same nurses. And they are certified oncology nurses within our magnet institution. They really help support the facility facilitate decision-making and access to health and wellness resources for practical assistance no matter where you're at. So they really help with the diagnostic support, advocating for the second opinion. Many people just go to their doctors and they hear the first time and they're like, that's my plan. And they're like, well, I don't want to offend my doctor. It's not about offending your doctor. It's about really helping them realize they're the ones that should be the one and power and choice of their decisions. And having a second opinion, every physician should respect and appreciate that value. Treatment education and resource allocation. So we give them a lot of tools. We give them questions to ask the physician. How do you navigate? Stay off the internet. God knows that is probably one of the worst things. And while these things all seem so menial, they are the most impactful components of people navigating this disease. We then, I will share with you, Cancer Bridge also doesn't only cover the employee, but it covers the entire immediate family. So when we talk about our 300,000 or 400,000 covered lives, it's not direct covered lives. It's actually the entire family. We kind of exponentially add that value to at least a member household of 5 people. Because if your grandmother's going through it, and our perception is that it's a family disease, like you don't do this individually. And so whether it's presentee, absentee, because your grandmother is diagnosed with cancer, or your parent, your child, or yourself, we are there to help support, and we really turn nothing away. We also, similar to Access Hope, we also have second opinion offerings across the country. We are working on more of those advancements. I think all of us Center of Excellences are working on those components because as many of you also know, no one cancer center is great at everything. We all know where the experts are. So when I get somebody who calls me from Southeast Asia that's an expat working for one of my companies, we get them to the best location for their brain cancer treatment with the best clinical trial advancements, and that could be Duke, not Ohio State. Because at the end of the day, it's about getting the best level of care for our client and advocating for them. Many times our physicians train with those experts around the world. So when they call us or our physician, I'll talk about our support network, they'll oftentimes say, oh, I train with so-and-so at X, Y, and Z. I'll make a phone call. And it's that personal for our employees, our contacts. So second opinion education and process. And I will tell you, we don't do the second opinion until after we have a very informal phone a friend expert. And I'll talk about that in a second. We also do survivorship support. We have a very robust program of what's after cancer treatment. And I think people don't realize the complexity of all the things that happen after. And I think it's a chronic disease. It's not an acute disease. Lastly is our outcomes. Really improving the preparedness for treatment and post-treatment includes greater confidence and greater satisfaction with care and employer. We help them with their appointment preparation, assistance, and debrief, and we also do the social support. So when I want to talk about the call line for a minute, when someone has a diagnosis, they call us through Cancer Bridge for one of our employers. The conversation will start with the nurse answering the phone. You don't have to give your number. It's very personal. It goes directly to them. They answer the call, and there's only like 6 of them, nurses. So typically it's the same person almost every time. It's very personal. They will call. They will tell them whatever scenario they're in, whether it's a survivorship need, whether it's a family need or personal need. So for instance, Jason Walsh diagnosed with prostate. I'm calling in. I tell them my plan. They will call. They'll tell me, did I get my second opinion? Did you ask these questions to your doctor? They go through the conversations of making sure that I am the most aware of my disease. If I say no, I have not a second opinion, would you like to talk to one of our prostate experts? So then they'll actually then connect me to a physician that is an expert in prostate cancer. That physician then oftentimes will call after 5 o'clock, personally that cell phone, and basically say, hey, it's Dr. Walsh. I'm a prostate expert here at Ohio State. I just wanted to see if you had any questions. Very informal. It's not a medical decision. It's not a second opinion. It's simply phoning a friend expert. So what we try to do is we try to take a VIP experience that a lot of executives will get with executive health, and we try to scale it to large employers because we think everybody deserves that same treatment. So what we do is we'll have that physician call them, they phone a friend, they give them the expert advice, and then they'll get them to where they need to be. And a lot of times Dr. Walsh will say, oh, you're in California. I have a friend who I trained with at X, Y, and Z. You should go see them as a second opinion, right? So that's how informal the process is. Or they'll say, do you want to see somebody here? We can create a virtual opportunity, or they can come to see us or somebody else in their local market. MD Anderson will oftentimes call us and say, why do you guys keep sending us patients? Because one of our clients has a large retirement population down in Texas. A lot of them call us. We end up sending them to the best cancer center in their local region, and then it's MD Anderson. And so then they go there and they're like, MD Anderson calls CancerBridge, like, why do you guys keep sending us patients? And they don't even know we're Ohio State, which is even funnier. So framework for supportive care is also there. Again, we have that phone line. I'm sorry I went through all this. I won't go over it again. We have the follow-up for additional case review. That's the oncologist of part 2. Part 3 is then, if somebody wants to opt in and actually have care navigation and get more into depth of their medical records and talk through the details of the components, we actually have one nurse who's assigned to all of our employers. When they convert to a cancer diagnosis and they say they want to opt into something called our care program, that nurse will actually personally connect with Jason and actually help me through every step of the process. Even if they want me to join meetings with the physicians or anything they want, they completely support that entire process and get into the details of their medical records. That is something we actually launched with a strategic plan. And then education for health and wellness is just ongoing. So we actually host about, I will tell you guys, this business has been going on for a long time. Ohio State just acquired it in 2019. I wrote the acquisition plan. We pulled it inside. And at that time, it had only one webinar every quarter for all of our employers. And so we wrote a strategic plan with our internal team. It was really beefing up the prevention, screening, and education component. So we do almost 25 events a month for our employers now, between healthy eating, during COVID, we did COVID education, even though it wasn't part of that. It was like, how do you deal with cancer and COVID? Because we were trying to make sure that we were educating the community on what was out there. We will do at-home screening self-exams, testicular examinations, breast cancer screening examinations in the shower, really educating the population, because we saw how the cost of care went up during COVID because people stopped going to screening. So then we were end up with all these stage 4 diagnoses, and we were like, we've got to get these people to recognize they have to be aware, right? So really influencing how they do at home. We do mobile, I told nutrition, we have a mobile education kitchen that goes out. We actually will host in-person screening events. So we send out our mobile devices to our local employers. We have breast cancer screening. We're launching a mobile cancer screening this year. If someone wants that in their local market, we don't have access, we'll find out who does have it in that market and help connect them with those resources as well. Doug, did I miss anything today? So with that all being said, at the end of the day, our biggest importance as an academic institution with this arm is really about elevating all boats as the tide rises with cancer care. Prevention, screening, early detection is key. Then it's how do you support them when it actually becomes a conversion. If you look at national rates, the conversion of while we talk about 1 in 3, it's not that high of the general population, but when it happens, it's the most impactful thing. And every one of us in this room knows about somebody who's had cancer in our family, right? So we can talk about lots of questions. I think Cody and I are going to come up here and answer any questions at this point. I have lots of other slides that I can reference if anybody has any other questions specific to the CancerBridge, but I just want to open up for questions and see if I can speak to anything. So Cody, you can come on over here. I think we have to be in front of the camera, so I'm being stage prepped here. So we're open to questions. Yeah, please.
Go wait for the mic.
Oh.
I didn't realize I had to use this mic.
Thank you. Dave Barchett, I'm a consultant with USI. So question for you, Jason, is this seems like a program that employers can purchase into as a, add-on to what they're doing.
That's right.
Can you talk a bit more about how they get access to that and the process of that?
Yeah. With cancer being such a priority, I think nationally, even with the president doing some of the stuff of Moonshot, I think there's been a lot of raised awareness. And so some of our health insurance companies have been looking at putting wellness riders. And a lot of times people will use that as an option to opt us in as a wellness rider on top of their current benefit plans. We charge an employee per head charge, and we're actually really inexpensive compared to our competitors. When we always share our costs, people are oftentimes surprised. But at the end of the day, it's really not about a for-profit entity. We are a not-for-profit entity. It's about public health and elevation. So does that answer the question? We work really closely with our partners. I have United Healthcare, we have Aetna, we have several folks, and we do a lot of warm handoffs with our clients because a lot of people will call about financial reimbursements or other components, and we oftentimes will connect with whoever their payer is and do warm handoffs.
So Jason, how do you work with a Quantum Health, for instance, who is a navigation type entity, right? Has their unique position in the market, not a health insurer, right? Not a TPA, but they're already doing some of the navigation where you guys are specifically, seems like you're obviously, you're focused on cancer navigation. How does that intertwine? Because I think we have a lot of plan sponsors in our collective, for instance, that utilize a Quantum Health type entity.
That's a really good question. So, like I said, we acquired the business in 2019. We've had many pillars of strategic advancements in our business. One of them was the CARE program, which we just launched this last 12, 18 months, which is basically the same component where we get into medical records and we can help with navigation. Now, are we scheduling appointments? Are we getting pre-approval for payment? We're not doing the complexity of Quantum's doing. We will have a relationship. If Quantum is a client of one of our customers, we'll interact with them, but we don't really use them in any capacity unless they're part of one of our partners, much like our payers. So I'll use an example. And I didn't play our video, Doug. I had a testimonial, which I wish I would have shared, and I passed over it. But we have Columbus Fire, for instance, and they're a United Healthcare partner as well. As you know, cancer prevalence in firemen is pretty high. We have our navigator for cancer experts. United Healthcare created their own care coordinator within their healthcare plan to help also advocate for prevention, screening, and early detection with the firemen. But they won't go to that care coordinator, because they don't have the subspecialty expertise of cancer that they know that the James and Ohio State has with our coordinator. In addition, they will only leverage our Cancer Bridge resource to navigate that. So I think it's an example of we still have a really tight relationship with United Healthcare, and we partner with their coordinators, but our client at the end of the day wants an agnostic party who's an expert in just that. If you have a Mercedes, you don't take it to a Hyundai to get it repaired, right? Dealership. It's really about getting the expertise. So we have a relationship. I know Quantum well. They're right down the road. Yeah. And for those who also Access Hope, really is also very similar to what Cancer Bridge is. The CEO that created it also created ours. So just so people are aware. Other questions? Did I answer everything? Some of the next phase for Cancer Bridge big pillars is really around, I think, getting alignment with data, I think, and population health, risk stratification with our populations, which is coming in the next year. I think that's really in an at-home testing as it finally evolves and gets to a place where I think it's a little more dependable. Many of us won't take a stance right now in the academic world or the clinical world to say that they're there yet. Some people will say that, but the FDA isn't either.
I have a question for Cody. So I took some notes, and it seems like you guys done a lot as far as like testing, biomarkers, covering a lot of like kids for your employees. The bottom line is, that's a huge value for your employees as employer. However, I'm sure a lot of employers looking into savings and looking at outcomes. Did you guys measure it somehow? Like, what are some learnings like takeaways for those who are looking and things like that?
Yeah, it's a great question. And I think that's where you start to see the data warehouse coming into play, like where we see the difference in cost based on severity level at diagnosis. So that's where you're immediately going to see cost savings is if people are getting diagnosed earlier at a lower severity, their claims are a lot cheaper, that treatment path is a lot better. And that's not even pulling in time off of work, the experience that they have with a more complex case and longer treatment path. So that is something that we're pulling in, and we're going to continue to monitor, like to see based on severity levels, are we seeing more early detected cancers? What are the price and what's the cost? Like we're seeing for other employers in this room, we've seen some significant high cost claimants this year, in particular around cancer. And so this is oncology cancer is usually a top 5 cost driver for most health plans and most employers. So there is a lot of spend there. And so that is where we're using the data warehouse to help us kind of build that out and see what the data actually looks like. I will also say, like, we do have Access Hope. I would say one of the pieces that we're trying to encourage them from an ROI perspective is to actually track patient lives after the recommendations provided to see, does the treating oncologist actually take that recommendation and put it into practice, and then follow that patient long term just to track ROI a little bit better? Because right now we provide this recommendation, here's kind of the ROI on this. We have also worked with Access Hope to send all of our cancer diagnosis there. So typically what they do is they say, we'll take your top complex conditions and we'll take those on because the ROI is there, like they can prove it. But we want to make sure everybody is getting, the right treatment at the right time. So for us, the ROI on that one isn't particularly built out as much. We are trying to work with them to see, is the treating oncologist taking this? Can you kind of follow these through and make sure, and they're willing to do that? But on the other side, it's like we're really tracking the severity levels and looking at cost of low severity at diagnosis versus high, and then can we catch more and more people early and justify it? But again, these things are relatively cheap. They're covered by the plan already. It's just really getting people to do it and accessing it. And the one other piece that I will mention is we were putting together that guide that it was a mailer and an email home that said at this age you should get this screening. And it was during that build, the guidelines changed, and it took UHC 6 months to update their screening guidelines. And so we were pushing our account team well, you're going to update our plan so that way it's up to date today versus 6 months when UHC as a whole updates. But there can be a lag between when the institutions update the screening guidelines and when the carriers actually update their clinical guidelines as well. So just something to be on the lookout for.
And let me add another additional component to that. I think these centers of excellence, like City of Hope, like the James, they're ones that are really keeping the tide high, right? And so I think those standards of care are coming from those institutions, which is why you see Access Hope knowing about that proactive, which is much like Cancer Bridge. And so really keeping that awareness in your communities and your employee groups is really important. I think the care program is similar to following the patients over time. I can give you so many anecdotal stories of an employee who comes to us and they'll tell us certain diagnoses and their treatment modality. And we kind of know what the general cost of care is because I am in the back end of the business side. Oftentimes when we say, did you get your second opinion? They'll get their second opinion. And we're like, actually, your treatment plan should not be that. It should be this. And it totally alters it. And we show a huge reduction in cost. And so sometimes that can be the other direction as well. Mm-hmm. They're not getting what they need, and they may need immunotherapy or some other clinical trial or some other opportunity. So then the cost goes back up. At the end of the day, I don't think I'm going to wash long term, but I think there are many cases where people are not getting the right treatment because the tides of all the boats out there are still relatively behind times. And so I think it's really about how do you get this expertise out into these rural communities and elevating the level of treatment everywhere, right?
Kevin Wetzel, Director of Solutions here at Employers Health. A couple of questions for you. In terms of you talked about tracking those guidelines, seeing that change, and then having, making that plan design change ahead of UHC. Who's tracking that for you? How can employers do that same thing? Because in my section, we talk about how quickly things change within this space, and waiting for our PBM partners can also take a little bit of time. So who's in charge of that? How do we initiate that type of process?
Yeah, I mean, I think it's just being vigilant yourself. I mean, I think what we learned was that the carriers are just slower to adopt changes. Like they kind of have their process for doing things. And so they can lead to delays. And so I think it's up to the employer just to keep track and ask questions along the way and like ask their carrier, like, what are the current guidelines? What are your clinical guidelines around this? What's your coverage look like? As you see these updates happening, and I think if you work with a consultant, I would also challenge your consultant to keep you informed, work with your carrier as well. Because it's a lot. Like I get it. There's a lot going on in benefit space today, right? Like we're talking about oncology today. If you're a benefits manager, you're probably talking about GLP-1s right now because of cost drivers going up. You're talking about high cost claimants. You're talking about healthcare trend in general. You're talking about provider groups leaving networks and employees sending you. No, it's like, why is our carrier not negotiating or not paying? Like, there's a lot happening right now. Sure. And again, like, there's been a lot of learnings we've had just in the last 3 years and continue to learn along the way. Like, we probably wouldn't have known that there was this gap in time in which the carrier adopts something versus when the institutions are coming out with these recommendations. And it was because we were doing a communication. And I was like, well, this changed from 50 to 45. And why is yours still saying this? Well, our coverage is still at 50. Well, here's an article that says that this has changed. So I think it is just trying to be proactive. Don't be afraid to ask the questions. Don't be afraid to push. Don't be afraid to work and hold your consultants accountable as well. But unfortunately, I think like there is a lot of responsibility coming back to employers right now. And so I think, we as employers have to make sure we're holding our partners accountable and like really working with us and being proactive in a lot of these areas.
A couple of questions. So the second one here is, you mentioned the qualified clinical trials, right? So for members with certain types of rare cancers, maybe a drug's not out, but they're looking for trial patients. That is a pathway that I've heard for people to get access to, maybe a cancer that doesn't have a treatment quite yet. Do you have any experience in how you help the members find that? And on top of that, how do you track that, right? Because I know under the Affordable Care Act, you're required to pay for certain parts of that or not the therapy itself, but the supportive care side.
Yep.
But how do you track maybe the drug itself and how that might be helping the member? And how do you get the member to those trials and how do you find them for that?
Yeah, so we're not tracking the member and how they're doing. I'll start there. Just transparently, we aren't doing that. Maybe we should. But the finding the clinical trials is where we lean on like Access Hope to help navigate people to the right institutions or to find the right clinical trials that might be available. So that's where we're really leaning on that relationship to help us navigate. I would assume that's something that Cancer Bridge probably helps.
Yeah, we're agnostic of clinical trial though, and so it just depends on. And I think Access Hope is now partnered with several consortium organizations to also try to get access to all clinical trials. But it also is much like these standards of care. When you talk about who's keeping you abreast of these changes, I mean, you have to rely on these centers of excellence to drive that because they're the ones doing the cutting edge, which is why we really kind of highlight the differentiation of our cancer expertise, like all the required education to be staying on top of how much the treatments are changing, right? I'm in this space and I sometimes catch wind of something and I'm like, we're doing what now? And so I say that that's similar to clinical trials. There are so many out there, and I think there's no real good database on what all is going on. And it really, at the end of the day, ends up becoming these researchers that are in these centers of excellence that all know who's doing the same trial and piloting it across the country to say, hey, here's your options, right? And we all do that, all of these cancer navigation places. So.
I realize I violated my own rule and didn't state my name with my last question, so I'm going to do it this time. Eric from Employers Health. So a couple more questions for you guys. The first one for Cody. So what would you say to the benefit professionals in the room if you take away one or two things that they can take back and try to implement to improve cancer care within their benefit? What would those one or two things be?
Yeah, I mean, I think if you can build an incentive program, there's value there. I mean, it's $120, $125, like is what we're doing. And I know that again, like a lot of employers are trying to figure out like, how do we control costs right now? Like we've seen a huge boom. But again, if you're getting people in for their annual screenings and you're getting them in for cancer screenings, hopefully the return will be there by catching things earlier on, chronic conditions earlier, cancer diagnosis earlier. And I think at the end of the day, one of the pieces that we're kind of forgetting in this day and age of data is that each data point is still a person. And so at the end of the day, that is a colleague, that's a family member, that is a loved one that is going through something. And I feel like that's a piece that we've missed as we've really kind of dove into data. Like we need data to drive every decision that we make. But guess what? When that's my loved one or someone I know, it changes everything, right? Like, and I think that's the other piece of this is like keep that human element as part of the story and why this is important, why we're doing what we're doing. Yes, the financials are important. And I don't want to be like naive that they aren't. But at the end of the day, these are human lives. At the end of the day, these are our colleagues. And by putting these things off down the road and just kicking the can, we're not seeing things get cheaper either. And so by really encouraging that prevention, that upfront proactive action, I think you're going to see that savings long term. You're going to see cost drivers in other areas as well. And so if you can get people in, get them screened, get them in for early detection, whether it's oncology, whether it's chronic conditions, I think there's been proof that catching these things earlier on is just overall for everybody's good. But again, I know cost pressures are there. We're experiencing it as well. Saying like we want to do an incentive program will probably be hard, like in a financial time, like when your CFO is probably already telling you like, hey, we got to cut down. But this might be an area to invest in and take away somewhere else. So that would be something I would invite you to consider if you're on this journey.
Can I add to that? Because I think it is absolutely about how do you incentivize your employees, but I also think there's this community engagement opportunity. And so when as a center of excellence in our community, many people know what Pelotonia is. And I think many of us cancer centers have our fundraisers. And whether it's cancer prevention and community awareness, or it's American Heart Association and a heart walk, whatever it is that someone's passionate about, or they've been afflicted with something, I think how do you as corporate partners also think about how you engaging your community and engaging your employees in those community events that oftentimes are promotional opportunities for health and wellness that actually help prevent disease, right? So for instance, every year we host Pelotonia. We have many, many corporate partners with Pelotonia. Genentech, many of you guys know of the group. Ohio State, Cancer Bridge, partners with those same employer groups. We create this huge community awareness event. So it really keeps it forefront annually. And in that whole summer, we have them training for bike rides to raise money for research to give you these cutting edge disease processes to absolve them. And so I think it's not just how do you influence and engage your employees, but then how are you as a corporate entity driving your community awareness and engagement. I think that you have to kind of be present there. And I think that helps your employees with their awareness and I think prevention. So just another advocacy.
Yep. Second question for Jason. So what do you think is happening in cancer care that employers and employees should be optimistic about?
Oh my gosh. There was a recent article around drug development. I think it was a solid tumor treatment for all solid tumors. I don't know if you've seen this over in Europe. There was an article that came out. I think City of Hope actually developed it, but there's a new med coming that dissolves all solid tumors. I think the advancement in our immunotherapy, our cell therapy, we're getting rid of these old archaic ways of treating with chemotherapy and using poison to kill cells, all cells. And we're getting into these very targeted, strategic. I mean, think about immunotherapy. I mean, it's the craziest concept. And then I think genetic therapies and influencing your gene reproduction and creating new cell pathways that create healthy cells versus malignant cells. I think that those are going to be our cutting edge differences. And I think these partnerships with these centers of excellence, the funding resources that go into developing these things, I think the greatest hope is, while I looked at that 35% by 2035, they're not counting all the disruptors that are going to come into the market and completely change that or eradicate the disease. We're at 75% of curing all cancers right now, and that's with some more archaic methods. One of my colleagues is a stage 4 colon survivor, He was in remission for 10 years. I won't tell many details because I'm probably violating HIPAA, but it's not through my medical information. It's through my social network. Bottom line is he ended up having a recurrence of his disease. He can't do any more chemos. He can't do any more radiation. He's now doing immunotherapy. He had another surgery, and he's doing very well. My point is, he didn't hear about that in the past. And I think that just the advancements of these diseases and being in such a great center of excellence, you're seeing great outcomes. Another friend of mine's dad was diagnosed with pancreatic cancer. That was a death sentence back in 10 years ago. I've been in the industry. I was an emergency clinician. I would get these people these diagnoses, and I'd see them 6 months later coming in and full arrest. I think he lived 7 years on a chemo med, and he was a stage 4 pancreatic. It's crazy, the advancements. And so I think not all healthcare institutions are providing that level of care. I think like many things, and so we talk about health equity and the importance of, I think, us getting out into the community and elevating those community resources as well. And it's not they're not doing the best they can. They're doing it on old standards, and it's about how does the information disseminate. It takes time, right? So I think the hope is, I think cures are right around the corner. I really believe that. And I'm not a physician. I'm not a researcher, but I'm behind the scenes seeing a lot of stuff that's going on. I share an example of, we also, the Bionic Man, I have a program that we do with limb preservation and nerve preservation. And so there's crazy components where people get sarcoma, they cut off their arm, they preserve the nerve, they put the nerve in the pectoral plane with a chip, and they put a prosthetic that actually works in their brain. And we have people doing that in our organization. So I'm behind the scenes seeing these things being done. And I'm like, if we can only get the cost down, because it's $1 million to have a prosthetic that works in your brain. But over time, that's where we're going. And that's an example of a different modality of treatment. But those advancements are crossed, and all these halo effects of all these great scientists are going to change the world. These partnerships of engineering, et cetera, which is why academic institutions like the Ohio State University with engineering and everything, we have all those resources at our fingertips. So hope is there.
Great. Well, thank you both. We really appreciate it.
Yeah.
And any last questions? Let's give them a round of applause.
I just want to say
One
the
more thing.
testimonials on there. One of our clients is Huntington Bank. While we are a local regional supporter, we also have international clients. There's a testimonial link on the email that will go out to you guys if you guys want to watch the testimonial. It's great to see. So,
What makes your employees feel engaged, loyal, and supported by their employer? Support during a time of fear and uncertainty is one way. Cancer directly impacts more than 1.76 million Americans annually, with 1 in 3 women and 1 in 2 men diagnosed with cancer in their lifetime. Now is the time to add cancer support benefits for your employees and their families. Cancer Bridge is a cancer-focused navigation service that provides your employees with immediate, one-on-one personalized access to world-renowned cancer experts.
Cancer Bridge provides our colleagues with access to the best in cancer care. We give Cancer Bridge access to our employees so that they can, if they either have family members themselves managing their way through cancer, they can go to our employee website and have access to Cancer Bridge from there. And then obviously everything is private and confidential unless employees choose to share it.
Employees utilizing Cancer Bridge are assisted by oncology-trained nurses who help them navigate the next steps in their cancer journey and connect them with a National Cancer Institute designated comprehensive cancer center and a team of subspecialized oncologists in their type of cancer.
I was diagnosed in 2014 with thyroid cancer. My first thoughts was, what am I gonna do? I didn't know. So when I received the phone call, probably about 20 minutes after I got my diagnosis from Joyce saying, hey, you need to call Cancer Bridge, it gave me my next step. I called and said, hey, this is what I've been diagnosed with. Can I talk to somebody to review my results and see if this is the best course of action? And knowing that I could just pick up the phone and anytime that I had a question, it was really easy for me. When you're going through cancer diagnosis and treatment, nothing is really easy, but I felt a lot more confident that I was gonna be okay.
It helped with the comfort. It helped with the idea of now I have to go down this path, and the uncertainties that I had before are still uncertain, but there is support with it, and there are some answers to questions that we've had and they've had when those answers that are provided through Cancer Bridge provide that assurance and that reassurance that there is a path and there are answers and there is an opportunity to recover and an opportunity to fight this disease. It's the morale of and the spirit of strength that I think Cancer Bridge provides.
I think they gave me the confidence to know that the path I was on was the right path for me, because they were there to answer questions and really just be a shoulder to lean on. Without Cancer Bridge, my journey would have been a lot harder.
Invest in your employees by providing Cancer Bridge today.